Now guys, the first one regarding this is Entamoeba histolytica, and in the Entamoeba histolytica what you have these particular ingested RBCs. What you have in this? Ingested RBCs, and ingested RBCs is termed as what? Erythrophagocytosis. Erythrophagocytosis. This is there. Fine. Erythrophagocytosis. And what is erythrophagocytosis? Engulfed RBCs. Engulfed RBCs, that is what is termed as erythrophagocytosis. And this is the characteristic feature seen in the Entamoeba histolytica as well. Okay. So this is important because parasitology, like a lot of fellows, they are telling up we are weak in this. So you can see these pictures before the exam. Your work will be done. And you know that we are having in and around as such direct questions of 15 to 16 in FMG exam, but relation is there with 30 to 40 questions. So that is there. That is involved in EIA. What is EIA? That is extraintestinal MBBS. And what is the most common site for that, guys? Most common site is liver. And you can remember that by mnemonic LLB. Liver more than lungs, more than brain. Okay. So that is there. Fine. So this is liver, the most common site for EIA. And which type of pus? Anchovy sauce pus or chocolate pus. Okay. Anchovy sauce pus or chocolate pus, and right lobe of the liver is commonly involved. Very well said. Okay.